Big Money Bound TV, RRT Posse, YouTube. Thank y'all for tuning in. To all the loyal subscribers, man, thank y'all for coming back and watching my videos. Thanks for all the continued support. I really appreciate it, man. If it wasn't for y'all, I wouldn't be doing these videos. I'd have no reason to do it because I have nobody supporting it. So since you're supporting all my videos, liking, commenting, sharing, keep coming back and watching, let me know how you appreciate the videos, how much they helping you. That's what I do it for. So thank the loyal subscribers who've been holding it down for a while now, who don't see more than 10 videos full length. You don't see more than 10 full length from beginning to end, you're a loyal subscriber, and I really appreciate that, man, for real, from my heart. From my heart. You know what my heart is. My heart like somewhere in the middle, so from my heart. But today what I'm talking about is how to deal with the family members of a patient that is in the ICU. Because this can be somewhat difficult and somewhat scary, man. You'll see if you're not already a respiratory therapist, or you haven't done your clinical rotations in the intensive care unit yet. You'll see what it's like once you go into these intensive care unit rooms. Normally it's a lot of family members, or at least someone is there with the patient because their loved one is like very, very sick. So you're gonna see they're very like on edge about what's going on, what are you doing, as they should be. So I'm just gonna give you a little advice, some tips on what to do and how to handle these patients, how to handle these patients' family members, so you have a smooth, easy work shift, workload, smooth transition. You'll have no problems, man. The most important thing when dealing with any family members, especially family members of patients in the ICU, you want to be informative. Inform the patient, inform the family members on what you dare to do, who are you, what is it that you do, and what are you doing. I'm sure if you ever been to the hospital, have somebody family that was in the hospital, man, you've seen somebody that works for the hospital taking care of your family member, just walk into the room, touch something, do something, walk out. But you like, hey bro, what did you just do? Like, what are you doing? I see your badge, but bro, what did you just do? Tell me something. Inform me, let me know who you are. So informative, giving information is key. First things first, you walk into the patient's room, a ventilated patient in the ICU. You see there's family members there with the patient. Off the bat, you want to tell them who you are, what it is you do, and what do you dare to do. For example, what I do. Hello, how you doing? My name is Randy from Respiratory Therapy. I'm here to take care of the patient while they're on the ventilator. I'm going to make sure we stay ventilated and oxygenated, and we have no respiratory issues. That's what I'm here for. So don't go in there, yeah, I'm in here to just see what's going on with the ventilator, take care of the vent. Oh, take care of the vent? The vent is a machine. I'm here to take care of the patient while they're on the vent. The patient is the most important thing. So yeah, I'm just here to get some numbers down and document some numbers. And I've been doing this from day one. I can't tell you how many times I walk into the patient room. Because, you know, if you've been to, I'm sure all you guys in the clinicals or you're a respiratory therapist, so you know how it is when you're in the unit. You can see the vent from the door. You can literally do all your documentations of the vent from the door. You can do that from the door. I went into the patient's room. Family was there. I explained to them what I'm there to do, who I am, what I'm doing. People told me, you know what, man? You're the first person to come. You're the first therapist to come in here. But you don't want to look shocked like, that's something that's shocking, but you don't want to tell it. You want the family to be like, you don't want to like shock the family because you're shocked like, what? We supposed to be coming into the room. You don't want to throw your other therapist under the bus, but you just got to like keep on your poker face and be like, oh, okay, yeah, you know. I just like to let you know who I am and what I'm doing. So yeah, I appreciate that, man. Yeah, thank you. I came back around the next time. It was the same family members there, but now the patient mom was there or the patient's grandma. It was like, another family members who had already seen me was telling the new lady who I haven't seen yet, they was telling her that, hey, this guy here, he's the nice respiratory therapist. He's the good one. They're like, oh, you're the good one. I heard about this and that. All because I came into the patient's room and told them who I am and what I'm doing. So yeah, man, that's very important. And when it comes to the machine, as soon as you get in there, when you assess the patient, and you're going to listen to the breath sounds. To the family, The patient is still there, still among them, still hearing them, still can hear them, still can feel them. So if you were to just go in there and just listen to breath sounds and get away, like I always say, I'm just gonna listen to your breath sounds to let them know I understand what's going on in here. The patient can still hear me. Can he? Can he or she? I don't know. I'm not in the person's body. I don't got the ears. I don't know. But I'm doing my job as if they can hear me. I'm gonna listen to your breath sounds. Okay, check out the breath sounds. You sound a little coarse. I'm gonna give you some suction, help you bring up that mucus. I'm talking to the patient who ain't saying nothing back, who's sedated, who's out of it. But the family members is here. You doing this for the patient and you also taking care of the family. You just going to listen to breath sounds, go to the suction. Whoa, like, sir, what the hell are you doing? Let me know something. So by informing the patient, you're also informing the family. All right, we're gonna help you bring up some of this mucus. That's it. Shh. Okay, recheck breath sounds. Okay, that's better. Now you go to the machine. You know when you go check out your ventilator machines, you gotta check your alarm settings. You may have to adjust your alarm settings. If you touch that vent for anything, these people looking at you wanna know, bro, what are you over there doing? Ain't nobody touched that all day. You touching the machine that's keeping my family member alive? Let me know what you're doing, please. All right, what I'm doing here is I'm just adjusting. You don't even got to be showing us. I'm just letting them know that you're touching it. What I'm doing right now is I'm just adjusting the alarm so if anything goes wrong, we can be alerted and we'll come in here and check on the patient. Bingo. That's what I'm doing. You checking out your peak, you checking out your plateau pressure, static compliance, dynamic compliance. You're doing all this. You're informed. I'm just checking out the lung compliance right now. I'm just doing this static compliance, lung compliance. I'm checking out what's going on. As I was telling the family member that. Lady was like, hey, no one's told us that before. Like, so what is this? What is that? What is this lung compliance? What is that? I'm like, okay. I told him what it was last time, told him what it was this time. So this time the patient's lungs is a little bit more compliant. Are they getting better? Never give nobody false hope. According to the findings, the numbers I'm looking at, the lung compliance is better. It is. I ain't tell you no lie, that's fun. The lung compliance is better. Yes, the lung. Is he getting better? Hey, is he or she getting better? The lung compliance is better. Oh, that's good, Hey, that is good. My homegirl wanted to had the same patient the next day. She was like, hey, did you go in the room, yada, yada? It's like, oh, because the family was saying, oh, I don't remember anybody but Randy from Respiratory Therapy. He let us know what was going on with the vent and what he was doing. They're like, yeah, they was talking about you. I'm like, yeah, I always do that. She's like, yeah, me too, but you're the only one that they remember and you did such a great job. Hey, I do what I can, man. Randy from Respiratory Therapy, Big Money Bound TV, log on, like, subscribe. I'm telling my homegirl all that, man. You feel me? So, being informative, man, giving out a lot of information, just let them know what you're doing. If you move the tube over from the left side of the mouth to the right side, it's supposed to be done every shift so the lip doesn't break down. Hey, let them know. Because you putting your hand over the man's mouth, moving the tube. What are you doing? All right, what I'm doing now is I'm just repositioning the tube so the lip doesn't start to break down because of the tube sitting on it for so long. Damn, that makes perfect sense. Thank you for doing that. We really appreciate that, man. You're doing your job. You just let them know what you're doing. That's it. As long as they're informed, and as long as you inform them, they're informed. They're less likely to just come at you and ask you a million questions. Because they feel like you tell them everything. They're not going to keep asking more and more. What's this? What's that? What's it? He's telling me everything I need to know. He's telling me, let me know what he's doing. What he knows is what he's letting me know. So that's a great thing to do, man. Another thing, when dealing with the family members of a patient that's in the ICU, you want to be a reliable person. If you say, all right, let me go get something, I'll be right back in 10 minutes. If you say 10 minutes, be back in 10 minutes. Oh, man, my lip, I keep biting my damn tongue. Shit, I gotta start wearing my retainer again, man. I start wearing my retainer, my lip, my tooth just trying to hurt me. But if you're gonna go and get something for the patient, you tell the family members, I'll be back in 10 minutes. Make sure you come back in 10 minutes, because trust me, as you would be about your family members, you're gonna be watching that clock. He said 10 minutes now. It's 8 minutes, he cutting it close. Oh, you just made it, because I was watching this clock. So if you don't know when you'll be back, say, okay, I'll be back as soon as I can. Perfect response. As soon as I can, I'll be back. That's all you gotta do. And if you're doing something with the patient, like, don't throw another therapist up under the bus. Let's say you go into the patient rooms you do mouth care. You have time on your shift to do mouth care. The other therapist didn't have time to do mouth care on their shift. So you get in there, yeah, I'm just cleaning out the mouth. Yeah. Don't go in there and say, yeah, this should be done once every shift. Once every shift. The last female didn't do it. She didn't clean his mouth. And you said once every shift? Let me get somebody on the phone. Whoa, bro. Even if it's supposed to be done once every shift, you don't know what the person before you did. Even though they may have told you, I did everything. But you don't know until you get in there. So, in my opinion, what you should do is just let them know. We're going to get a patient some mouth care. Make sure we get all the nasty stuff out of his mouth. Make sure the breath is nice and fresh, minty clean. That's it, man. We all got to brush our teeth. I'm sure they understand. That's what you're doing. Yeah, this should be done once every shift. This hasn't been done for the last 3 days. That's not good. But you don't want to be the therapist that's responsible for getting all your coworkers in trouble. But maybe you do. But if you want to avoid getting anybody in trouble, just go and let them know what you're doing. Don't let them know what should be done every shift. You feel me? Because I had a situation where I walked in the patient room. I started the patient on a treatment. You know, everybody got a way that they set up the nebulizer. It's certain nebulizers that you can put the mask on top, or you can put the mask pointing diagonal. I prefer to put it on top and just sit right here instead of have it diagonal at the patient's nose, and it's kind of like pinching the top of their nose piece. So I have it straight up. But I guess the therapist that came behind me, she like hers diagonal. I'm assuming she told the patient, yeah, this is wrong. They're doing this the wrong way. This is that. This shouldn't be done like this. Oh, baby, you don't threw me up under the bus. So I had the same patient the next day. Lady said, yeah, the therapist came in here today and she was saying, oh, are they still doing this wrong with the nebulizer and this and that? Yeah, she said it was done wrong. Now, I gotta cover my tracks and explain that it's not done wrong. It's a way you prefer to do things. It's a preference, how you prefer to give a patient the treatment. Like, some therapists may like to listen to the left lung before they listen to the right lung. Just because I go to the right lung first and not the left lung first, that doesn't mean that this person did it wrong. It's a preference. You know, it's a million things. It's 10 ways to do one thing right as a respiratory therapist. You can do the right thing in numerous different ways. Lady was like, okay, I understand. Thank you for explaining that to me, because they were saying that it was done completely wrong. Don't throw your buddy up under the bus. Like, what's going on in here? But this is what I'm saying. It's different, bro. Everybody come from different backgrounds. Everybody come from different upbringings. Like, everybody ain't raised how you was raised. Like, you got a certain code that you live by. Everybody don't live that same way. That's just a part of the real world, man. Especially in this white collar line of work, you feel me? So you gotta get used to that. Another thing is, make yourself seem very reachable. After you don't explain everything to the family members, tell them what you're doing, you don't did it, tell them when you'll be back, you'll be around every 4 hours, every 2 hours, whatever. Last thing you wanna do is make yourself seem reachable. So they know if there's something wrong with this patient's respiratory rate, respiratory status, you can be reached to come back and save them since you're the respiratory therapist. All right, what I'm gonna do now is I'm gonna put my phone number on the board, so if you need to reach me or the nurse needs to reach me, I'm only one call away. I'm reachable. Oh, thank you, I appreciate that. And that's it, man. That's how you handle the family of a patient that's in the ICU. I appreciate y'all for watching the videos. Please, man, like, subscribe, share my videos. Come back and watch more of my videos. I gotta stop drinking them Jarritos, man. Hey, them Jarritos got me going, man. So y'all have a good day, man. RRT Posse, Big Money Bound TV. I love the support. Keep showing love, man. What we represent, man?
Big Money Bound.
Say let her know, man.
Big Money Bound.
P.S. I can't stop, y'all. I can't stop drinking them, man. I'm sorry. Woo! Damn, these things are good.